All right, you ready to thrive using PLLA in the lower face?
In 3 minutes?
Thriving in 3 minutes.
I'll try to do it in 3 minutes.
Let's see if you can get it down in 3 minutes. That's not easy for you.
All right, so here I'm using PLLA reconstituted at the FDA approved amount, which is 8 cc's of sterile water and 1 cc of Lido with epi. In practice, you can also use 8 cc's of bacteriostatic water. It hurts a little less than the sterile water. And I'm essentially using a 1 cc Lure Lock syringe attached to a 25 gauge 5/8 needle. And I don't use something that's smaller in diameter because the PLLA particle may clog your needle. I do have my nurses kind of assisting me, moving that product back and forth in the syringes before they pass it to me. And I'm depositing 1 cc along the maxillary suture line and then all across the zygoma on bone, withdrawing back with each injection point, delivering between 0.1 to 0.2 cc's of product.
So I want to say something important here. You're aspirating on each one of these injections.
Yes, especially here laterally where you could be dancing with the zygomatic facial artery or the transverse facial artery.
And are you down on bone?
Yes, I'm down on bone. So here I'm going down on bone again. You could get into the aberrant branch of the facial artery, so it is important to withdraw back so that you don't get into it.
Okay, and you talked about the recent FDA approval. You can mix it immediately, right? And then go right?
You can reconstitute immediately with 8 cc's of sterile water and then 1 cc of light.
And vigorous shaking, go right away.
And vigorous shaking for at least 1 minute.
How many cc's will you inject into a face?
So right here I've injected about 1.5 cc's along bone supraperiosteally because she's young, she's in her 40s and she's got a good fat to cover it. But if somebody's like a cachectic 60-year-old with not a lot of superficial subcutaneous fat, I won't do such large depots along the maxilla and the zygoma because of fear that it may conglomerate and you may see nodules of product. But I will deliver about, again, 1 to 2 cc's along the bone, and then I'll work my way with a longer needle, like we did in the study. It was a 25 gauge, 1.5 inch needle, or you can do a 25 gauge or a 22 gauge 2 inch cannula to minimize bruising, and that's what I'm going to do in this video in a moment. I do prefer the cannula, although it's off label.
Cannula where?
To cover kind of deep subcutaneous fat pads of the cheek, also to get into the piriform fossa, although you can also do the needle, and to also treat kind of along the lateral cheek fat pad where you do see a lot of masseteric veins and can cause bruising.
And the key here is not to be too superficial, right?
Well, in these areas, you are, in lateral cheek fat pad, you are kind of superficial.
What about
You're in the
nodules?
subcutaneous fat pad. Just the most important thing is to do nice thin strands so that you don't get a lot of product aggregation. Remember, with PLLA, nodules are not granulomas, they're just product aggregation.
Okay, and then how many treatments do you offer patients?
So here you can actually see me going deep.
Yeah.
I lift up my cannula, so I'm in the subcutaneous fat pad, withdrawing and delivering about 0.3 cc's of product with each linear
Wait, but do you get
strand.
concerned around the orbicularis muscles?
Here I am going all the way up to orbital retaining ligament. As long as I'm not putting big boluses, I do believe that when you inject along that orbital retaining ligament, that's a lot of collagen there, you can get a nice contraction of the tissue around the eye. And now I have patients for 5-10 years out where you can see the thickening of the skin around their eye because that skin doesn't live in a vacuum.
All right, once again, how many treatments do you do on these patients?
In clinical practice, I generally have my patients come in and then I do a repeat again at like 3 to 4 months when they come back for their toxin. I don't have them come back every month like the clinical trial because you can continue to get a fair amount of biostimulation.
Even beyond 1 month?
Even beyond 1 month.
And how long do you tell patients it's going to last for?
I tell them that at minimum it lasts 2 years. And that the results do not plateau off. They continue to age, of course, so it's probably best to come back for a touch-up at about a year.
And what kind of patients do you in particular use this type of product?
All patients. I think everyone can benefit from this. So
Wow.
She's a 40-year-old. She's got some acne scarring. She wants to improve quality of skin, but she also has some volume loss. She's an excellent patient for it. Your 20-year-old, early 30-year-old who's trying to kind of pre-rejuvenate, not add a bunch of volume, but kind of maintain the volume she has. She's a great candidate for it.
Do you layer it?
I will layer it with other products. I'll maybe do the PLA in one session, and then I'll do like an HA in a different session.
I use a lot of PLA in patients who I think are very thin, and I would normally do fat transfer, and I'm afraid that if I use an HA, it's going to give them too much of a bulky look, or you see too many lumps and bumps, so I will use this type of product. I think it works great, and the skin quality, which we didn't talk about yet, is really impressive, don't you think?
Yeah, the quality of skin is great. I mean, it's a nice adjunct to people that you're doing lasers on, because it does thicken up the skin quite substantially, and that's what we did see in the clinical trial.
All right, so thriving in 3 minutes with PLA in the face. Very impressive.
Thank you. Bye.
Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.